Hi, everyone, and welcome to another VITA Learning program. Today we're going to have Peter Pizzi that is going to go over the basic porcelain build, replicating a two-shade, or otherwise known replicating nature with an understanding of ceramics. So this is going to be a nice program in which Peter's going to go over the workflow, if you will, of ceramics, maybe catch a couple of things that nobody's ever thought about, you know, from Peter's expertise and experience. So just a couple of house cleaning things. Everyone's phone is on mute. If you'll notice on the right-hand side of your screen, there should be a panel that if you have a question, use the question box to go ahead and submit your question. And depending on the nature of it, frequency of the question, same question, I'll either interrupt Peter at that time, or we'll save it to the end of the program where we have a Q&A. So use that box, that question box. And then the workshop itself will be recorded. You'll have an opportunity to revisit it later this week or next week or whenever, if you want your staff to listen to it as well, or if you just want to look at it, review it, and if you've something was quick and you wanted to learn more about it. It will be recorded. It's recorded on our VITA Learning website, on the YouTube channel. All of our programs are posted there. At the end of the program, that's when you'll receive, anybody that has registered, you will receive an email from VITA North America Education, and you will have an opportunity to capture some CE as well. So Peter owns his own lab. Those of you who are unfamiliar with Peter, it's Pizzi Dental Studio out of Staten Island, New York. He's been a technician since 1984, has a CDT and an MDT. So he actually took the time to learn technology, dental technology. So he's up there with the class of its own. So he has a personal appreciation, expertise in all phases of traditional and digital dental technology and photography. Works with clinicians, works with laboratories, does private trainings, does numerous lectures, member of the American Academy of Aesthetic Dentistry. He's a graduate and recognized specialist and mentor of the Coyce Center for Dental Excellence, and he's the co-editor-in-chief of Inside Dental Technology. So welcome, Peter. How are you?
Thank you, Jim. Good morning to you. Everything's good.
All right. So we are going to go ahead and turn this over to you. You are now the presenter, and you can show your screen, and we'll get going.
Great. Okay, well, thanks, Jim. Good to talk to you as always, and welcome everybody. Appreciate being here, and appreciate all the people who sign up for these webinar series. I know we're all jonesing to get back out, and hopefully soon. But I know I actually have some flight dates. I booked some flights already, which is actually kind of fun. Looking forward to seeing some faces up close and personal at some point. I'm double vaccinated, so that feels very nice too. So today's purpose is really about breaking down ceramic in general and kind of giving you more of a basic understanding of my system and my process of how I do that. For me, to do that and basically be able to explain it well, let me just get on to my next slide here. Why am I not moving? There we go. Okay, so understanding. So let me go back one. So the idea of replicating nature, and by the way, I'm in my office in case you haven't realized. You can see the lab behind me. For those of you who can have a video, you may hear a phone ring or some little noise here and there. So I apologize for that, but it's a working day like the rest of you. So when we're talking about replicating nature and trying to create an understanding of it, for me, the key word really is understanding, right? It's really about what you know and how you utilize that information. And for me, I've tried to create systems. So I would argue that I'm not that good at anything I do. And in order for me, sorry about that, in order for me to be able to really get an understanding of what I need to do, I want to be able to break it down and systemize the process as much as I possibly can. So I systemize my laboratory, my environment, I systemize my ceramic buildup, my case management. We're going to break them down a little bit today. I'm going to skip through the patient part pretty quickly, but yes, I have a system even with the patient. So when I see a patient, I'm looking for 3 or 4 main things. For one, I always want to see what the face looks like. I call that facial or face. I want to understand what the dental facial portion is, or the white part. Where are the teeth? Where are the lips? And then the third part for me is what I call the pink or the dental. And that's really that close-up component that you see on the screen all the way to your right. And for me, that's a standard with any case that I work on, whether it's a wax-up case, a full mouth case, an upper arch, lower arch, doesn't matter. I need to make sure that I have that information. Obviously, I don't need that for a single molar dentistry, some posterior teeth, although we've kind of, I don't want to say trained because that sounds like a bad word, but we've kind of trained our doctors and our system that we kind of follow the same procedure for every case. So it really just makes it easier. This way, there's never that question about should I or shouldn't I, what should I do, what shouldn't I do? Do it the same. And the only time I deviate from systems is when I'm trying to improve on something. So if you look at a case like this, we've taken our basic shade system, and obviously we have an entire process on the shade taking process of what we do and how we do that. I won't go into that today because I really want to get more into the ceramics. Wax up was done, provisionals were made, and in that provisionals, we're going to evaluate that provisional back to the face to make sure that we like what we see, the patient is happy with that. Once we have that, this happened to be a refractory case, so it's going to be what we call a refractory veneer case. I'm old school. I still do a majority of my veneers on refractory. I know some people are foil. Also, a lot of people today are pressed veneers. And I would argue from an aesthetic point of view that although pressed veneers have some viability and definitely usefulness in certain cases, it's not my go-to for my first option. For me, first option is feldspathic. I like to think that's one of the things that separates us professionally sometimes. I know when I'm in laboratories, a lot of times they say to me, or when I used to be in laboratories before last year, a lot of people say to me, you know, what difference if I press this and another lab presses this and we both stain it, it looks the same, and how do I differentiate myself from the market? And the real way you differentiate yourself is through your knowledge and through your ability to change what you've milled, pressed, or digitally designed to add to that, to really make that more aesthetic. So for me, I'm still very old school in the veneer world. It doesn't mean that I don't use lithium silicates and D-silicates for veneers. Of course I do, but majority for me, actually you saw over my desk, behind me I have probably 6 cases that are all full arch veneer cases right now that are all refractory. So yes, we do a lot of that, but I guess what I'm getting to is the point is, it doesn't matter as much what the final restorative is, as long as you have systematic approaches to what you're doing and how you're doing it. So in a case like this, and I'll walk through this one quickly and then I'll break them down a little bit more. I have refractory dyes. I know the basic information as far as what shade am I looking for, how much translucency, how much opacity, and I'm basically going to start with what I would normally do. I want to get some value in the center of the tooth, and I'd actually want to start creating a little bit more length on the tooth by using more opacified materials. And I know this is really common for most people, right? Maybe a little opacious dentin or an effect chroma to extend your coping or your start of your veneer. Very common, nothing new there. Then I'd start bringing in my dentins, maybe a chroma dentin in the cervical, something a little more brighter in the mid-third, a little more whiteness, and again, based on what that final shade will be. And then I'll start finishing off that incisal edge. Then I finish off that incisal edge with a translucent material. That could be depending on the kit that you use. For me, it might be EE9 or just my my water drop in the Lumex kit, depending on which material I'm using. And again, I'll break these down for you a little bit more as I go on. Then my Mamelon materials, and the goal with the Mamelon materials is always the same. I'm trying to utilize Mamelon materials to do a few things for me. I'll show you that as we go through our time together. I'm utilizing it to mask some of the light transmission or what's behind that material. Because remember, when I'm looking at a tooth, a lot of times in the incisal edge, this is where the most light is going to go through. So I'm going to use my mamelon materials to do some of that masking. Also, I'm trying to emulate nature with the mamelon materials. That's what I see when I'm looking at a natural tooth. And then, of course, I'll just finish this with my enamel materials. I might use a few different enamel materials, sometimes a lighter, brighter, sometimes something a little bit more translucent. And as complicated as this seems, I'm going to try to break it down for you that it doesn't seem complicated, because I understand. Again, I've been in a lot of the labs in this country and around the world, and I see what's happening. And I also understand that we've learned to simplify our processes, right? So are we using 2 powders? Are we using 15 powders? Are we using 6 powders or 30 powders? And I would argue that none of that really matters as long as you have an understanding of what you're doing with the powders. So I get it in the production environments. I hear, well, we use 2 powders or 3 powders. That's all the time we have. And I've always said, and it's kind of a real kind of a baloney excuse, it doesn't take you longer to pick up a powder and put it on the restoration. That's really just a poor excuse. What it does take you longer to do is to think about why you're picking up a powder and what effect it'll have when you place it on that restoration, how you use it. So for me, it's really more about the understanding. And I think that's why it becomes so critical that as we start to place our restorations in the mouth, that we have the ability to see what they look like. And if we don't understand that, it really makes it more difficult for us to understand, or simpler for us, I should say, to say, well, I use 2 or 3 powders and they always look good. If you want the honest answer, they can't. It's virtually impossible to basically use 2 or 3 powders and replicate what nature does. Does that mean that I want you to use 9,000 powders every time? Of course not. But I also want you to understand that to achieve a certain level, there are certain products and powders that you will need to get yourself there. So in this particular case, I think you saw I probably used maybe 8 or 12 different powders. Sounds like a lot. For me, that's not. For me, that's kind of the norm. But also when I'm teaching, I also feel like when you're using 2, I'm not going to try to get you to use 12 the next day, because that's not going to make any sense either. So we usually try to incorporate one new thing or something that's a little more of an additive, just to add to what you're building in that restoration. Also, when I'm building my restorations, I'm only thinking about the ceramic. I'm thinking about the face, the white, and the pink. And if you look at this veneer on insertion, notice how nice the gingival tissue looks as the doctor is actually inserting that veneer into the patient's mouth. And that's what I'm really looking for, because in order for my work to look okay, the gingival harmony has to work in there too. It can't be just, I built a pretty crown, but it doesn't really work intraoral. It's a combination of those 2 things. So managing the face, the white, and the pink are all critical aspects. Our patient was numb here when the doctor took a few of these photos, and obviously the papilla hasn't filled in yet, but it will, because this is just on insertion, and we've managed the biology for that, so I'm not so worried about it. Final veneers on insertion. That's the day of insertion, by the way, which usually those are the worst pictures to take because of so many differentials that are happening. But even with the patient numb, you can see that they're smiling and they feel comfortable. And I follow that system across the board. So the exact same thing. Another case, a combination now of refractory and some zirconia. Again, face, white, pink. I want to look at what the face look like, where the teeth belong, and where the pink and gingival aspects are. This one I'll walk through a little bit quicker for you guys, because I let you have the basic concept. The only thing I didn't talk about before was diagnostically, when we can add wax to teeth and create the shapes we want, that's your best scenario. When you have to prepare the tooth to add the wax up to, it's a little more challenging, but I actually like the ability when we can do some additive wax ups like this one is, because then we can take that additive wax up and transfer that to the patient's mouth, and that gives us the best evaluation of what we see provisionally, what we like and we don't like. And then the beauty of that is once we know the tooth position, we can now do something called an Abt technique, which is basically where we start to prep through the temporary, so the provisional material. And that allows us to be the least reductive to the tooth, because remember, minimal invasive dentistry is really our key. And I know from the ceramic point of view, we all fight because we say, well, we need more space, we need more of this, we need more of that. And I'm going to argue that you don't necessarily need more. You need the right amount, and you need to understand the space that you're working in and what is the proper material to use in that space to make this work. So in this particular case, we're going to minimally invase those few teeth that he has in his mouth. We're going to make a 2-unit cantilever zirconia frame to fill the pontic area on the number 10 or the 2-2, depending on which system you use. And you're going to see I'm going through the exact same process. Right now I'm using veneers and a zirconia material, but I haven't changed the system. I'm going to use something with more chroma in the middle, whatever that may be, and also more opacity. So in this example, if I'm trying to build an A1 case, I'd probably be using A2s or A3s here, something higher in chroma, but yet more opacified, like an opacious dentin or an effect chroma that I have more opacity out of. And I'll do the same thing to extend the tip of my coping. Maybe I'll go into a lower value opacity, something like a C shade, which I don't normally use, but I might use it to extend the tip of a coping to keep the value down a little bit lower. And I'm following suit exactly on the refractory as I am on the zirconia, no different. And then I'm going to start, I'd fire that just so you can see that. I don't normally fire that. I normally kind of build this more in one bake, but after that, I'll come back and do my dentins. I don't use one dentin. I might use 2 or 3 dentins. So this is that area where you say, well, I'm only using 2 or 3 powders and I'd like to start adding a second or third. Well, maybe the simplicity is just change the dentins. Instead of only using 1 dentin, try using 2 dentins. Use 1 more for chroma, 1 more for value, and that'll start to change the flow and the landscape of your restoration. Again, simple dentin build up here. You can see I've actually incorporated a little bit of a mammalian feel. I've created some space for my enamels and translucents. And then I'm going to finish that frame off with what I call a canvas. And I will break that down for you too. Sorry, I'm going fast because I want to squeeze a lot of things in here. In my canvas, you'll notice that it's basically the final shape of the restoration. But what you see there is actually more opacified or chromatic dentins that have a value to them, and then translucencies are enamel. Now, why am I not being specific about which powder? Because it doesn't make a difference. If you're building a case that's A4, well then let's use the common sense. What would I use here? I'm going to use A4 or A5, something more chromatic. I'm going to use something with a little higher value here, like an A3 or maybe even an A2. And then here I'm going to transition between my A2 and my A4 to get that lower value and translucency. If this was going to be an A1 case or a 1M1 case, same premise. I might use A2 or 1M2 cervically. I might use 1M1 or OM3 in that middle third area to brighten it a little bit. And again, I would transition between those 2 colors to get towards the translucency and the incisal. So I'm not being vague by not giving you specific powders. I want you to kind of think of it more as a systematic approach rather than he did this, he used this, he put that there. I'm treating it the same for almost every case. And this is why I'm kind of walking through these cases quickly. Then I go up to my mammalian materials. My mammalian materials, I might use 1. Sometimes I use 3. It really depends on the case, the age of the tooth, and the effect that I'm looking for in that incisal region. But again, I'll break this down for you better as we go on. Enamels, instead of using 1, I'm almost always using 2 or 3 enamels. To be honest with you, I think if I'm building an ideal scenario, I would say to you that you cannot really produce nature or replicate nature without having about 6 to 8 powders in your system. Now, that doesn't mean that you have to use 50 powders every time, but I'm going to tell you, anytime you're under 6-ish, it's very difficult to really reproduce or replicate what you see in nature based on all the differentiates, the different values that you see between the chroma, the value, the translucency. There's not one color in a tooth. So I want to be able to break that down as I go through and understand them. So again, I'll cover this with my enamel, very similar to what I did before. And then I'll get my final bake going on that, clean up, polish, and we'll insert that in the mouth. You can see that I have refractory veneers on 4 teeth and a zirconia subframe on the other 2 teeth. So I want to make sure they match very well. This is on insertion. These are not my photos, sorry about that. You can see there's probably a ring flash, a lot of brightness in the center of the tooth, but you get the idea that my refractory veneers blend just as well with my zirconia materials. So I manage that by managing the space of those materials and that's always the key. Okay, so let's break down the ceramics itself so we get a better understanding. That's how I manage through my cases. Now let's manage through the ceramic materials. For me, everything starts with nature. Your understanding of nature is really critical, and I often make the argument that we as technicians and our doctors do not really understand nature as well as they should. You know, it's funny, I've done a million courses in labs, and a lot of times when I'm sitting in the lab, there's always that one technician who kind of challenges you, and they're like, why don't you do a case for this doctor? He or she is so bad, and they never give us space, and they never do this. And I say, you know, I'll gladly do it. I said, but you understand they're going to remake the case after I do it. And that's when the technician usually goes, well, yeah, because, you know, they're difficult. And I said, no, they're not going to remake it for that reason. They're going to remake it because they're not used to seeing what teeth look like. They're used to seeing what we've been doing poorly for a long time, right? That's taking a restoration, using 1, 2, maybe 3 powders, building it up big, grinding it into shape, painting some colors on it, and expecting that that's what a tooth should look like. When I make a tooth, if I made a tooth for you in your lab and maybe I put more texture than they're used to seeing, the doctors aren't used to it. So they're like, well, why are these so rough? Why aren't they shiny? Why haven't you glazed them more? And I'd say, well, because teeth aren't glazed. Glaze is a term that we've created. Natural teeth have a luster or a sheen to them, and that's different from patient to patient. So not everything should be the biggest, shiniest thing that you could put in the mouth. Or when I build a molar, I might put more chroma and deep staining in the fossa. Oh, our patients don't like stains. Okay, they may not like stains, but am I matching the teeth next to it, or am I just making a beautiful white tooth to put it in the patient's mouth and they'll never see the job that you did anyway, right? It's about understanding the process. So for me, nature starts this way. If you look at a natural tooth, notice that the cervical area or the cervical third is always going to be more chromatic. It's actually more translucent too, but it's a very difficult area to get the translucency we need because of the amount of space we work in. And I'll give you some areas to address that and help that. The middle third of the tooth is where you always see the most value of the tooth. And this is the brightest area of the tooth. And when patients come here and I explain to them about shading and what we're going to do, I always try to explain to them that what makes a tooth look natural is not that it's white from the gingival to the incisal. It's having different zones and different values. Now, I'm also really cautious with my patients not to use certain words. I don't use words like yellow or brown or pink in the word chroma, because the minute I say that, they don't get that. But for us as technicians, if you look at the gingival aspect here, what do you see? You see a hue. Usually it's an amber, sometimes a yellow, sometimes a pinkish, or sometimes a combination of that. And without that little hue in the chroma or amount of chroma in the cervical, you'll never get a tooth to really look like a natural tooth. Part of that hue comes from the reflectance of the pink gingiva. Part of it comes from the actual coloration of the dentin underneath it by the CEJ. Now, where that changes is when we get into that middle third of the tooth. And this is really where the brightness of the tooth comes in, or the most value. And you noticed before when I talked about the build-ups kind of quickly, I said to you, well, if I was building an A1, maybe I used an OM3 in the center of that tooth. Why would I do that? Why wouldn't I just use the A1 or the 1M1? Because I'm trying to change the optics of light. I'm trying to make it so that one area contrasts the other area. And if I want my middle third of this tooth to really pop out in value, I need a material to do that. I either need more opacity or more brightness to do that. And then as I get to the last part of this is the incisal edge. And I always say the incisal edge is really more about the age of the patient that you're building than it is about what we see it should to be. Of course, everybody wants to make a pretty incisal edge with mamelons and translucencies, but not for everyone. So my protocol is I base my age, my incisal edge based on the age of the patient or the effect that I'm looking for. An example, that tooth that you see on your screen is a beautiful tooth. Look at the mamelon structures, look how nice they are, the translucency, and it's shot under a polarized filter, so you really see all that depth in there. But would that tooth look good on a 80-year-old man? No, it wouldn't fit. It would almost look like somebody took a set of dentures and popped them in their mouth without it really fitting into the rest of the face. So do I always build mamelons? No. Do I always build that much translucency? No, it's dependent on the age of the patient and the effect that I'm trying to work through. So for me, that's the simple breakdown. Chroma, value, incisal edge, effect, age, translucency. I want to think about each of those as I work through my case and I work through my patient. How do I do that in ceramic? I break it down the exact same way. For those of you who have worked with me before, I work with something called the canvas concept. This is something I developed over the last 10, 12 years of teaching, and it's really based on nature. What do I mean by that? When I'm creating a canvas, I'm creating a flat wall of what nature starts out as. What is that? Chroma in the cervical area. So whenever I'm using a system, my system, whatever shade I'm going to get to, I know I'm going to use something with increased chroma cervically. Again, you're building 1M1, that cervical is at least 1M2. And by the way, I've used examples, I actually took it out of this lecture for time, but I've used examples where I use A4 chroma to get to a 1M1 at times. And why? Because that might be what I need based on the space. And I'll get to the space aspect in a minute. But right now, my canvas is going to be based on chroma in the cervical, value in the middle third, and then my incisal effects and translucency will be age related. So my canvas is a copy of nature. That's all it is. And I want to make sure that I'm utilizing that to understand what nature looks like. And then it's a matter of space. How much space do I have to work in? So let's talk about space for a second. The biggest complaint I get teaching, I used to get when I was traveling, I can't wait to travel again in case you can't tell. The biggest complaint I get is lack of space. The doctors don't give us enough space, they don't prep the teeth enough. And I have to be honest and tell you, that's true only to a small percentage. Yeah, there are some doctors that don't prep enough, that don't understand that, and it's really easy to blame them. But I'm going to be honest and tell you that most of the time when people give me a case that the doctor didn't prep enough, they tell me they don't have a space, I'm usually adding ceramic to it. I'm not taking away ceramic. And the reason for that is I would argue, we don't always understand the proper form that needs to be, the shape that that tooth needs, or what powders would help give me the space, it would help to utilize that space better to get the effect that I need. So when we talk about space, we talk about it this way. The average full coverage prep is 1.2 to 1.5 tenths of a millimeter. That's standard for full coverage preparations. And just so you know, every ceramic manufacturer has built their ceramic to work in that world, 1.2 to 1.5. That's kind of the nature of the beast. So that means that when we build ceramics, and I've built many ceramics, I've been in almost all the ceramic factories in the world, my understanding of what we're supposed to do is we've utilized about 1 millimeter of space for our dentin and 0.5 millimeter of space for our enamel, 1.5. We put those two together, that's what works. Now, does that really work? Kind of. If I want to match an A1 shade guide or a 1M1 shade guide, and I use 1 millimeter of 1M1 dentin and 0.5 millimeter of the enamel that goes with it, I will match that shade guide. So manufacturers have done a great job applying that formula for you. The challenge is, do you want to match a shade guide? I would argue no. And the second challenge is, do you always have exactly 1.5 tenths of a millimeter of space? I would also argue no. Sometimes you have more, sometimes you have less. And now it's your job to figure out how to fill that space with the right material, because dentin alone won't do it, especially at only 1 millimeter thick or as we get thinner and thinner. So for me, the ceramics are really about optics. And what I'm looking to do is utilize ceramic materials to bring the optics into the tooth the way nature actually does. Let me explain to you what I mean by that. If I look at a natural tooth, like you see here, and I actually put some light on this tooth or highlight it, notice how well that light transmits through the tooth. Look at how much light actually, if I put a little light on the root or behind the tooth, look at how the light transmits all the way through the tooth. And what's great about this is that's what nature does. So our job is to emulate what nature does. One of the challenges we pose is that the minute we prepare a tooth, although optically it's still the same, we're usually covering it with some sort of a substructure, zirconia, lithium disilicate, metal ceramics, you name it. Whichever one we use, we're basically putting a cap over that tooth. That cap becomes a light blocker or the ability of light to actually transform into the tooth the same way it would. So the best example of that is, look at when I put a coping on this natural tooth. And again, wouldn't matter, zirconia, lithium disilicate, metal ceramics, same. I basically create shadow over the root. And when I create that shadow, what tends to happen is when you put that in the patient's mouth, optically the tooth doesn't transfer light the same way as the adjacent tooth next to it, unless they're all restorations. But when you're matching one tooth or two teeth, this is one of the biggest challenges of getting the optics in there. How do I manage that? I always make my copings as ceramic margins. Now, just saying that, I can see a few of you shaking your head saying, oh, we hate ceramic margins, we don't want to do them, they don't always work for us, the preps aren't good enough, all the excuses pop into play. And I get it, you're right about most of that. I struggled with it for years until I was able to kind of get my doctors into the path of prepping properly, modified shoulders, understanding not to create chamfers with these heavy angles on it, and getting away from feather edge preps whenever possible, because those are the least amount of space we have to work with. That took time, it didn't happen overnight, but I also get not every case is ideal for ceramic margin materials. The advantage of the ceramic margin materials for me though, just to be clear, and I use them in so many aspects, but just to focus on the margins right now, I don't just use them for margins, I use them for many areas. Just to be clear though, ceramic margin materials are very highly fluorescent, which as you see to the right of your screen, teeth have a high fluorescence to them. And they also, because of their fluorescence, even though they're not the most opacified, they tend to reflect and absorb light better than other materials. So for me, in my chess game of ceramic, I always say the ceramic margin materials are really the queens of our chess game. They really can do the most in the least amount of space because of their fluorescence and their optics. They're really a nice material, one of my favorite materials to kind of work with across the board. If you don't use ceramic margin materials because preparation, design, time factors, whatever excuse you might make on that, and I'm being cold and facetious on that, but in truth, we're always looking to figure out an easier path, and sometimes there's not an easier path. So if you don't use ceramic margin materials, there are other ways around that, but it has a lot to do with really increasing the chroma of what you use. So that's why I said, if I'm building a 1M1, I might go as far down as an A3 or an A4 cervically, because I need to instantly increase chroma, because chroma, the higher chroma I have, the more light absorbance I get. So it's a way of kind of tricking the system by increasing the chroma, getting the light to absorb, and making it appear much lower value or more translucent cervically. That would be an option if you're not creating ceramic margins, which by the way, I do for almost every case, including zirconia today. The only time I don't create ceramic margins is with lithium silicates and disilicates, and that's usually because of the case management and the space that you have to work with. But years ago, when I started doing zirconia, I started doing ceramic margins. I got away from it from a period of time, and then as I started really evaluating my cases intraoral, I realized I need to cut the zirconia back, even the translucent zirconias, and get some better optics. So my system works with any ceramic you use. I predominantly use mostly all VITA ceramics, whether it's VM9, the new Lumex, or VM11, which I actually really like too. And my system works the same across the board. It's my job to understand the powders. And what I mean by that, if I'm using opacious dentin or flow dentin, like in the Lumex kit, or I'm using an effect chroma or a chroma plus like in the VM kits. Basically, I understand their opacity and where they're useful for me and where I want to apply them. So like I said to you before, cervically is usually the area where I have the most difficult area managing. I try to manage that really with my margin materials or increased chromas. Middle third is where I'm always raising my value. So even if I'm building 1M1 or A1, I'm usually jumping to a brighter powder there. And then as I get towards that incisal edge position, I'm thinking about the light transmission that goes all the way through because I no longer have a substructure there. And that's one of the harder areas for us to manage. So think about this from a light perspective. When I shine light here, the light has the ability to go all the way through the tooth, right? You see where the coping or the actual preparation ends. But when I shine light here, I always have a refractive index of either the substructure or the preparation itself, which means it's a different optic. The only way to really manage that optic is to manage this space differently than you would think. Point being, if I'm using 2 or 3 powders and I use a millimeter of dentin all the way up to this incisal edge, do you think optically it's going to look the same in the middle third as it's going to look here? No way. Because behind this millimeter, you have a coping, you have a preparation, you have something of color or merit to either absorb or reflect light. Where here in the incisal edge, you have nothing. And light will pass through that dentin because your dentin is not opacified enough on its own. So I'm going to need to either change the opacity, this is where you use opacious dentins, or I might need to put something else in there. For me, mamelon materials. I said the margin materials are the queen of the kit. Well, mamelons might be partner to the queen because they're right out there. Mamelons are highly opacified. They're also fluorescent. That means I can use them in much thinner spaces and still get a lot of light dynamic out of them. So for me in these areas, I'm going to most of the time be using some sort of a mamelon material to hide that transition between the coping and the following rest of the tooth. And again, this is most challenging in single central world, single lateral world, where we really kind of face that trying to match nature next to it. This was a single veneer that I did, again, refractory, for a doctor friend of mine out in Ohio right now. And I think it worked pretty well. So no prep veneer. You can see it blends and flows pretty nicely. Very little space. There was no prep. So you're talking, I had 0.2 of a millimeter, 0.3 of a millimeter to work with. Yet it's my job to understand what powders will work well in that scenario to create that natural flow and make it work well. In order for you to do that, I would really say that you really need to understand the powders well. First question I usually ask ceramists when I'm teaching a hands-on course is, what's the opacity of the dentin you use? And most of the ceramists stare at me like I'm crazy and they say, well, I don't know what the opacity of the dentin I use. And if I gave you some numbers, you'd be kind of surprised. So if I took dentin at a millimeter thick, which is what the manufacturers needed for you to use in that 1.2 to 1.5 gap, that dentin is normally only about 30 to 35% opacified. That means that 1 millimeter of dentin, 65 to 70% of the light is actually going right through it, which is why when I tell you only using a dentin enamel doesn't really work to get you to that next level. And the example that I use here is, this is opacious dentin at a millimeter thick, dentin at a millimeter thick. And notice the difference of how the light passes through. But also one of the challenges on it is, when do you use opacious dentin at a millimeter thick? Hardly ever. So the thinner I get with the opacious dentin, the more it becomes like dentin and the more translucent it becomes. So that's why sometimes being able to use mamelon materials or other materials that are highly opacified help me to manage the light a little bit better, especially based on thickness. Because again, remember, 1 millimeter of dentin, about 35% opacified, but 0.8 of a millimeter of a dentin, now you're only about 25% opacified. So that means you're getting more light that goes through the material, makes it more challenging for us. A good way to think of this is from an opacity scale. So depending on, again, what kit you use, and I bounce back and forth between 2 or 3 different powders, the 9, the 11, sometimes the AC, whatever the scenario you're using, I'm always thinking of it from an opacity point of view. Which powders have the most opacity? Which powders have the most translucency? Obviously, your opacious dentins are usually the most opacified in your kit, but realistically, they're not more opacified than mamelon materials or even technically margin materials. If I want to be technical, margin materials are less opacified than your opacious dentins, but because they're increased fluorescence, they react more like they're heavily opacified. So it's really about the fluorescence in the material. Also, a lot of the newer kits, like the AC as an example, you're going to notice that we've added fluorescence into some of the materials. So like in the new Lumex AC kit, there's a flow intense. And that flow intense really means that it's a fluorescent dentin material or mamelon material that actually gives us that little extra added fluorescence to give you more light interaction and more light bounce. So I'm kind of thinking of my powders on a scale all the time. And what do I need to fill the space that I'm working in? I'm not thinking A1 enamel, build a crown. I'm always thinking about the space that I have to work in. The other thing that I'll pick on when I'm in offices and I see the way people are firing their restorations, your firing parameters are so critical. You know, I've always joked that there's a big difference between mixing up a beautiful mix to create a souffle and place that into an oven and let it raise and cook the proper way, or just take it and scramble it up quick and say, it's eggs now, and it's all flat and mushy and it's nothing really useful. Ceramic kind of has the same path. When you overfire it, you're damaging the optical nature of the material, and when you underfire it, you're damaging the optical nature of the material. So in the end, your firing parameters are really critical. What I noticed in probably 90% of the labs that I've been in around the world, and it's an around the world thing, it's not an American thing, most people overfire their ceramics. And the reason they do is because they look so much better in your hand that way. When you look at them on the cast, you're like, oh, this looks so great. Look at the colors and the translucencies. But when you overfire them, you make them more translucent. Intraorally, that lowers value and makes them look a lot lower or deader in the mouth. So the firing parameters are really critical for me, and managing your furnaces to do that properly is really an important part. I use very accurate furnaces, accurate to 1 or 2 degrees, because I want to make sure that my time spent building is not wasted when I put it in the furnace. I want to make sure I'm managing that. Also, your understanding of how to manage, and what I mean by that is, how do you manage a space like this? This is a young girl. She fell, broke her 2 front teeth. We don't want to prepare the teeth because there's no reason to. We want to replace what nature actually had there, and I'm going to replace it just the way nature would. But I also have to really think about that. Think about that amount of space and think about, how do I fill that space? Because it's really small. I'm dealing with, I'm lucky, about 1 millimeter of thickness in the thickest spot. And as I get towards the inside of the edge, maybe 0.5 millimeter of thickness. What powder is going to work there in order for me to fill that space and actually make it work? So again, my understanding of the powder system is going to be what separates that, and your understanding is going to be how you approach it. So right away, I know I'm going to go to something much more opacified. This was actually one of the first cases I ever did with the Lumex porcelain, and I'm going to go to something much more opacified, like an opacious dentin, or a flow material that's going to have a little more fluorescence to it. In this case, I used the ivory material. Why? Because I wanted something very white and bright and really opacified to fill that little space. And once I was able to do that, then I'm going to start using my normal materials, maybe a dentin, maybe a little bit of an effect, an enamel. I love the water drop, is kind of one of my favorite blue translucents in that kit. And every kit kind of has your favorite powders that you like and that you want to use. I'll cover that with a few enamels and we'll fire that. And if you take a look at it, and this is kind of what I wanted you to notice, look at the difference. Look at the density that is inside that restoration that I've used, that ivory flow material or one of the flow dentins that I've used. And look at the translucency that I'm going to make that to join on to the other tooth. And the combination of those things is what's going to make that work in this space that I'm working in. So we'll take those 2 veneers, we'll bond them in the patient's mouth, and she moves on and can go through life kind of normal again without us prepping the tooth. But really the key was managing the material, understanding what materials to use and when to use them. This was one of the second cases I did with the Lumex. Again, another challenging case, single central. This is where really the rubber meets the road, right? And I wish I could tell you I get these perfect all the time. Baloney. This case I did 2 or 3 times before I got it right. Almost every single central I do is usually at least twice. Sometimes the patients aren't as picky or they don't show as much, but in general, I can't say I nailed them all on the first shot. I wish I did. Sometimes we get really close, but if I'm looking at it, usually I want to make some tweaks. So how do I manage that? Again, space, right? And in this case, I did something a little bit different. I used my actual margin materials to help build up the internal aspect. Why? Because I didn't have much space to work in, and I wanted that fluorescence and that opacity on the inside of the restoration. So I kind of switched the game a little bit, but still following a similar system. What do I mean by that? Chroma, gingival, value in the middle third, translucency around the insides of the ledge. The system didn't change, just my choice of the powders changed a little bit. And you can see as I slide that up in the mouth, the patient was actually here when I finalized it. It looks pretty okay considering I'm working in about less than 1 millimeter of space. It's not cemented at this point, but you see the coloration works fairly well. And I'll take a photograph or two of it under polarized so you can really see the differentials. Polarized lighting kind of flattens and masks everything out. And you'll notice that it has a very similar light transmission across the board. So that's kind of what we look for. And by the way, if I change materials, right? So you saw refractory, you saw a little bit of zirconia. If I go to lithium to silicate, same premise for me. If I'm using maybe saprenity, which is another material like it's the lithium silicate, it's a milled material. In its soft state or in its putty type state, we'll mill this out. You see how nicely it fits in the mill right on the die, and then I'll sinter that and make it into a useful substructure, let's say, because it's kind of in a honeycomb state. It's a nice material. For that, I can only use the VM11. And by the way, I actually put this photo in, so I wanted you to see. Can you almost notice that there's a little bit of an opalescence to this material? I tried to photograph it in different lights so you can kind of get an idea. That's one of the nice things about the lithium silicates rather than the D silicates. I think optically they're a little bit better. So I'm going to use the exact same system, but I'm going to make a little twist again. Again, I want chroma in the cervical. I want value here, but I have very small amounts of space to work in. So I just coated this with a little water drop, a little blue translucency. And instead of putting my brighter dentin on in the center, I went straight to my mammillon materials. I basically bypassed the dentin at this point, went straight to my mammillon materials to create that little mammillon type effect that you see there. And I utilized them to not only create the incisal effect, but actually give me a little more value in that middle third. Then I went to my dentins. And again, in this case, I'm only using a translucent dentin. That's all we really have in the VM11 kit, but then I'll go a little dentin right over that, brush that down, back to my enamels, and back to the same scenario, right? So again, I'm using the same system over and over again. And the goal of that is really just to keep it simple. And the only modifications I'm making are based on my knowledge of the material. So if I'm making an argument for you to improve on your ceramics, it's your understanding of the material that's going to really make that change. No matter what the case is, not only the boy with a million cases today, I think you get the idea, right? This is a full zirconia case. We got some blanc span bridges, digital involved case. I use the ST VITA zirconia for this. We used it in white. I actually tend to use only white or A1. Those are pretty much the only two shades I use for zirconias today. Very rarely that I use a darker, only because I'm making them so thin and making ceramic margins on it. Even if I want to create an A3 or an A4, I can get it out of the A1 core. So I don't mind that so much. So you can see the long span bridges. It was actually 2 bridges, 2 different pieces. That was pretty much on insert. And again, just a simple, same exact buildup. So let me just break down one more thing for you before we run out of time. One last case, I want to kind of break down the mammillon materials a little bit for you and how I use them. So I won't go into too many details of the case. You'll notice the patient had a fluorosis on their teeth and a very difficult case to cover. They also had another issue with what we thought was a missing tooth. It was actually just a tooth that was never orthodontically came to the position it should have come to. So we did something extreme. We actually broke the bone and moved the teeth out a little bit quicker because we didn't have time to wait for a year of restoring. The patient was moving away. And then after we got that movement happening, we treated this case like a normal feldspathic case. Now, here's what I wanted to show you to finish up with. In this case, I actually did something a little bit different. Again, same premise, same canvas, but I just changed the material options. I actually used an effect liner material as a powder, not as a wash. Most of you use your liners more as washing them on your coatings or on your substructures. I don't ever really do that. I tend to always use them more as powders. I could have done this with my margin material. The only reason I use the liner material is because some of you just seem to be more comfortable if I call it a liner material. But let me be clear, most of the liner materials are very similar to the margin materials. They're more fluorescent and they're a little bit of a chunkier base material, meaning optically they tend to reflect light a little bit differently. So I use a liner material for this, but I use the same system. I built a little chrome around the cervical, a little value in the middle third, and then I extended the tip of my copings with my liner material. And then after that, my buildup was very much the same. I created my canvas, my dentin, and I have a little video here that I'll let you watch and you'll understand some of the mamelon technique that I'm using. I've used my mamelon materials with a glazing medium. I thought I did that because I wanted to change the viscosity of the material. And the goal of that was really just to be able to control the material, being able to place it where I wanted to and create the effects that I wanted to. So I'm going to use a little bit of that glazing medium now. I'm just going to hydrate this incisal third of my two anterior teeth. And the reason I'm doing this is what I'm trying to do is almost create a barrier between where I'm placing these and what's behind it. When you look at natural teeth, you'll see the mamelon tend to float in space. So I want the same thing to happen here. So I'm going to take some of my mamelon materials and start placing them in areas I would like to see them. So if I want a little bit of warmth, I'm going to give myself a little bit of warmth. Sometimes I might want the warmth way inside, you don't even notice it that much. And I'll place a little bit there. Then I can come over that. If I wanted a pinker mamelon material, I'll just lay right over it. Get something with a little different pinkish kind of effect. You can use more of a yellowish or an amberish kind of a color next to it. So that's my basic mamelon technique. At that point, I'll then take my brush and flatten it and maybe cut them a little bit or try not to make them look so placed. So I want them to kind of flow in nature. So if you look at the picture to the right of your screen, you'll notice what that effect actually looks like. This is the same case. And by the way, I actually have, I think Jim and the VITA team actually have all those videos. We were working on them. I actually have this entire case video, the whole build up, and it might be fun. We're trying to put something together where we can actually have a whole course maybe just on that, because it's nice to see the entire build up from the whole process, maybe a little faster, sped up version of it. Obviously teaching and talking at the same time makes it drag out a lot longer than the normal. But you'll see what happens with the mamelon effects, right? I paint my mamelons on, I break them up, and if I put some light behind it, you can see how that little bit of mamelon actually stops the light from getting through, and where the mamelon is not there, the light transfers through that more translucent ceramic. And then after that, it's the same. Back to my enamels, again, usually 1, 2, 3 enamels, depending on the case. And then after that, I'm going to polish the case, surface topography, polishing, and I want to make sure that I'm really getting a nice surface in there. I tend to overdo my surface topography in the beginning because I know I'm going to spend a lot of time in my polishing areas, and I want to make sure that I'm getting as much naturalness as possible when I do that. So you can see this was actually an upper and lower arch of veneers, and the surface texture is all there, and then we'll place those intraoral. So the patient goes from there to there. Oops, sorry, I went through that a little fast. Patient goes from there to there. Great guy. It's actually Minaj, really nice guy. He became a prosthodontist. He was a dentist in our program at NYU, so it was nice to restore him. These pictures are taken 2 years after. I think it was about 2 years after we did the restoration. So fortunately, all is still looking good, and I'll knock on wood that it stays that way. It always shows in the face, and I think that's where the key is. And at the end, I think all the little details that we've talked about, and I want to be clear about those details. Chroma, value, age-related translucency, embrasure space, surface typography, those are all the things that make the ceramic better in the end. So with that said, I think I'm just about on time here. I'll say thank you to you guys for spending time with me. Seems like there's a lot of people out in this lecture today, so I really appreciate you guys spending an hour with me. I know Jim wrote the topic as basic ceramic. This is as basic as I think it can be. So again, for the 2 or 3 powder people, I get it, and I want to help you be able to get to 3 or 4 or 5 or 6. But the only way you're going to get there is by having the knowledge of which ones are going to make that transition. And for those of you who are already in the 8, 10, 12 powder range, we can improve that too by understanding your placement, your positioning, and how to make sure they're not bonding together and changing the coloration or becoming complex grades. So with that said, maybe Jim, hopefully people have a few questions. I think I'm about on time here. Let's see. Yep.
Yep, we have some questions. So what you're trying to do is lift everyone up, right?
Well, isn't that the goal? Right? I mean, I think you know me well at this point, Jim. Is look, you've heard me say it a billion times. I assume some of the people listening today have heard me say it a billion times. Where is good is what we know, and our viability isn't shattered by how digital the world has become or how fast or strong things become. Our viability is shattered by us not taking ownership on what we do and how good we get. So for me, I want us to be viable. I want our whole profession to keep growing. And I want you to take all these great digital things we have and be able to put the pretty on them, because that's what's going to separate you this year and even 5 years from today.
All right. So just a couple of things. Thanks, Peter. It was really good. Just a couple reminders that on your CE, you're going to receive a email from VITA North America Education Marketing, and so go ahead and reply to that, and then they can give you the letter, a certificate, or the register you for MBC credit. It has been recorded. It's on our VITA Learning website, which is also VITA North American YouTube, and so forth. We have also links through LinkedIn and Instagram, YouTube, of course. You can always reach us, besides Peter, if you need to. You can always reach us about any information here at the help desk at VITA North America. This is some of the information that we have, that you can contact us, if you will. There's Paul and myself. And then we have, of course, the sales reps that are in your field that are eager to help you out. Please contact us for that information as well. Just so you're aware, we've got several of these webinars lined up with Peter. We got him pretty busy this season. And this doesn't even include all the personal in-person programs that you have going on here, Peter. So we've got numerous different topics, maybe a little bit more than just the basic next time, but we have an array of different topics, like how to do internal coloring or external manipulation, and how to build up making a picture perfect case, and so forth. So different subject matter, but please attend another one of these webinars with Peter that we'll have. You can register here at the VITANorthAmerica.com/courses. And then we have the questions. So let's look at these questions. I'm going to, just for the heck of it, I will bring my camera in too. So there I am, but we've got many of them. So let's start with, Peter, have you ever experienced lithium disilicate veneers in the thickness of less than 0.4 millimeters? They get a translucent color in the area which gets thinner than 0.4. Is there a problem because of the way that we press, or because lack of thickness? So what's your experience with very thin?
I kind of missed a part of that. So just repeat it.
Yeah. So have you experienced using lithium disilicate veneers? So in other words, when you do lithium disilicate, have you experienced doing a veneer of less than 0.4 millimeters? Do you get kind of an odd translucency from it?
Okay.
You know, is it gray under 4.4?
Yes, I think I know where they're going. So think about what I just said with ceramic, right? At a millimeter thick, it has a certain opacity. At 6/10 of a millimeter thick, it has a different opacity. The thinner I go, the more translucent any material comes. I think one of the things we all struggle with, especially with the lithium disilicates, is choosing the right ingots, right? Am I choosing the most opacified, the most translucent? And depending on what you're using, if it's an Ivoclar product or the Anterior product from us or other products that are out there, Haas has one now to so many, it's still about your knowledge of how to utilize that material. The thinner you get, the more translucent they come. And what you need to really be thinking about is how much space that I have to work in, and am I pressing, milling the right ingot for that? We are almost always, and I say this, like I feel like I don't need to say it, but it seems like some people still need to hear it. I don't think we've ever pressed an ingot that was the exact shade that someone has asked for. So if they've asked for an A1, we're pressing a bleach ingot. If they're asking for an A2, we're pressing an A1 or a B1, something of a higher value. And then we're always looking for the most opacity if we have less space. So if I have 4/10 of a millimeter, I'm probably pressing, you know, if you were using the Ivo, it would be an LT, or ours may be a more opacified. If I'm going to layer on it, I still treat it very similar, because in the end, I need opacity inside in order for me, because of the thinness that I'm going to have with the restoration itself. So it's about the opacity and the ingot selection, I would say, is really the answer.
All right. And then just to follow up, so with those thin veneers and you go to a brighter material than the ultimate shades, do you guide the dentist as far as the adhesive or the cement, like tell them use a neutral,
Yes.
use a clear?
So
Okay.
every restoration I build, my dentist, I want my dentist to use a transparent material to place them 100% of the time. The minute the doctors start using colors, you did a bad job, because if you didn't get the coloration you need based on the prep shade, the amount of space you have in the final results, them adding color behind the tooth, especially in the thinner veneers, really just kills them, because they become more opacified when they use opacified cements. So for me, it's always about translucent. And one more thing I'll throw out, Jim, it's a little off topic, but I think we're doing a lecture on it at some point. I like lithium silicate. I actually like both lithium desilicate and silicates. I truly like the silicates better. I think they're more optically useful for us, and I use them more today than ever before. But I also have to be honest, in veneer work, I don't think they're the greatest materials for veneers. And when I can, if I can't do feldspathic, I go to another one of our materials, Jim, which is the Mark II, which is really my favorite material for veneers these days. I gotta tell you guys, if you milled a Mark II veneer and then milled or pressed a lithium silicate or the silicate veneer, you'd be like, I'm doing this one all the time. This looks so much better. Now, it doesn't mean you shouldn't do the others, because there are times when you need the others, and Mark II isn't for everything either. But I have to be honest and tell you, it's probably my favorite new material the last year or two that I use for veneers more than ever before.
Yeah, and I think a good point that you bring up is really, as technicians, we need to start exploring different materials to see what they do, how they look, how they compare, so that you can select the right one. And I think this is a big part of your lectures always is select the right material for the right indication, and you should be good. So, all right. There is a question by Margaret. What is the minimum connector area you use for zirconia bridges? I think to kind of help you along with this, probably more of the default that's in your design software more than anything, but is there rule of thumbs that you know offhand?
So the minimum is 4 square millimeters for zirconia. That's what we're told. Have we cheated that number? Of course. It's probably more about 3 something, and they tell us 4, so they know we're going to cheat. I showed a case in a lecture yesterday that I did for NYU group and some of you guys may have seen this case before, where I used 5 different materials for a full mouth rehab. One of them was PFM, one was zirconia, one was feldspathic veneer, and one of them was layered, and one was monolithic zirconia. So I said 5 completely different materials. And the question I got yesterday was, why did you use PFM? And the real reason was connector size. I had long span bridges, very thin interocclusal space. So like Jim has just said to you, your knowledge of when and where to use them. You know, manufacturers are really great at making materials and telling you why they're the best. Your job is to know when, where, and why to use them. And that's where I think we're trying to help, is really for you to be able to pick and choose the right materials at the right time. Simple answer, usually in zirconia, it's about 3 to 4 square millimeters in order for it to be strong. And I don't do bridges in lithium silicates or D-silicates. I know some people recommend it. I don't believe in it, to be honest with you, at this point. So zirconia, 3 to 4 square millimeters, metal ceramic, 1 millimeter you can get away with, and any other material to me is not bridge material.
Yeah, so that's a good answer. I think all of us have to continue to understand about materials and so forth. Scott is just, he's asked maybe in the future you can do something on a molar, which probably in all the presentations you're going to do, we'll probably cover that in a later date, I'm sure.
I'd love to.
All right. So
when I come in, there's a few molars on my desk. I don't get those days very often, but when I do, I love it.
Yeah, I'm sure. And then you can, you know, I know we got one we're covering maybe margins to do that, and then veneers. So I mean, we've got so many topics scheduled out that it's going to be nice this year. All right. So let's see the next one. It is, I'm having trouble getting cervical chroma with VM13 opaque, so metal ceramics. It always seems too chromatic. So when I use the sun opaque and the other opaque modifiers, or haven't used enough of the shade, it doesn't come through. So I know you've used some VM13, Peter. The wash opaque for VM13 is a very sunny color already. But do you modify your opaques if they're too dark? What do you do?
Yeah.
Opaque-wise.
A few things, and I'll try to move to this answer quicker. For me, whenever I'm working on a substructure, PFM, zirconia, even lithium silicate, I consider my substructure. I always want to create those same canvases, chroma value and translucency. When I have less room, I need to really increase the ability quickly. So what do I mean by that? I said to you before during the lecture, if I'm building A1, and I've used an example, I took it out of this lecture, I feel like I showed it so many times that it annoys me, but I built an A1 where I used A4 opacious dentin cervically, and everybody thinks that's crazy. Why would you do that? Well, the reason I would do that is because that A4 opacious dentin is only going to be about 0.2 of a millimeter, and I wanted to get the chroma as high as possible in that very thin area. So that's one way to manage it, is to be bold and not be afraid to really increase the chroma or the powder that you're using, and you'll see it better. The other option is to modify the coping more. So when we do PFM, which we still do a good amount, we have a standard system. And again, that standard system is really increasing the chroma cervically if I'm not doing a ceramic margin. So again, you're doing A1, use A4 at the cervical, use A35, use something with a real intense chroma. And to be safe, especially in the larger labs, don't jump from A1 at the cervical to A4 at the cervical day one. Try A2 for a week or two so you kind of get used to what you see. Try A3 for a week or two so you really get to understand what that differential does for you. I have a billion slides on it, but maybe we'll address it more as we get into a metal ceramic course.
All right, so Martin had a question. How do you manage an anterior with a dark core? So I assume that's not a non-PFM, it's more of a all ceramic or a zirconia oxide type. How do you treat a dark core?
I would tell you the answer there is PFM, right? Get away from other materials for that. Again, that's managing your, how many single essentials that I've done that I say, I'm gonna do this one in zirconia, and then I see it in the mouth and it looks dead, and I realize the prep shade was black and the doctor didn't give me that information, and now I'm dead to the water. So I can get the most coverage in the world with a 0.2 of a millimeter coping, right? Metal coping. Nothing else can I get that with. So if I have a really dark prep shade, And I now have to mask it with zirconia because I'm doing the rest of the case in zirconia, or the doctor asked for zirconia. Realize I need a very light, bright, or opacified zirconia material. And again, this goes kind of against the manufacturer concepts. The manufacturers spend a lot of time in the last 2 years especially telling you how amazing translucent zirconias are. But they're only amazing for certain things, not for everything. So a lot of times when we're in that situation, we go back to our old school zirconias, the most opacified, and we try to leave them as thick as possible and layer the most minimal amount. But in all honesty, metal ceramic is your simple answer.
Yeah. Yeah, no, it makes sense. And a lot of people don't, I mean, for the industry, we're still doing an awful lot of PFMs around the U.S. So it's, you know, it's amazing that we got away from a good product. So another question by Scott is, do you mix the opaque dentin with the dentins?
No, I used to do that years ago, but not anymore, no. I mean, all you're really doing is creating a more opacified dentin. I actually like the ability of changing the optics, meaning that I'd rather have one powder with a certain opacity, another powder with less opacity, another powder with less opacity, than have one powder this thick that has the exact same opacity going through it. I used to do it, but not as much anymore.
So kind of a related question, but up in the incisal third. You use various materials for your incisal third, depending on the translucency. The question is, do you just use enamels in the incisal third? Do you use enamel throughout the facial?
I mix that, so it really depends on the age and the effect that I'm looking for. If I want a real translucent look, then a lot of time I'm going straight to the enamel, right? And then enamel could be EE9 mixed with EE10, or it could be water drop in Lumex, and depending on the system that I'm using. If I'm looking for more of a gradual transition, I might make 2 mixes of that powder. So I'll give you an example. Let's say the case I just built was a VITA case. I actually made a mix of a TD1M1 dentin plus EE9 plus EE10. So that's my first mix. My second mix is just EE9 and EE10 mixed together. So what do I have? I have a powder that's really, really translucent, and the same kind of a powder not so translucent. And that allows me to gradually get more and more translucent as I go up by placing opacified, translucent, or maybe scattering every other dot that I'm putting on as a more translucent look. Again, it all depends on the look that you're looking for. If I want a wall of translucency, then go straight to the translucent materials and cover that with your mamelon materials. But if I want a gradual effect, like more in a single central I'm trying to match, I want to scatter some translucency with some opacity.
All right. And then an easy one for you, pipe from Elizabeth. What are the brushes you use, and what size are they? What brand and size? The brushes that you use, the brushes that you use for stacking your porcelain, what brand name and what size?
So obviously I have my own brush. I've had a few different over the years. MPF made one for years. Harvest made one recently for me. Lately, I've kind of gone back to old school. I'm using an older brush that my friend Naoki produced, and it's a size 4. And I've been using his brush a little bit more. It's a more natural hair. You know, the problem with the brushes has always been the same: getting the consistency of the hair and the Klinsky sable. It's a long story, but it's difficult to get the hair as consistent as you like. I don't love the hybrid brushes, so I kind of stay away from those. And today I'm building up, if you look on my desk over there, is my little red-handled Naoki brush, because that's the one I've been comfortable with lately. But I have my own line. I should be telling you, buy my line, but buy the one that's best for you. Buy the ones that you like the most. For me right now, I've switched, and next month I might switch back to another one or build another one. We'll see.
All right. Okay, last question here. Have you had a challenge with gold post and core intermingled with tooth color preps in the aesthetic zone? And if so, how do you handle it?
Yeah, so I mean, I think it's kind of the same question as the other one, right? When you have a darker prep shade or a middle prep shade, what do? Metal ceramics is the simple answer. The other option, though, is opaque. One of the things that we can do is if we have the prep, we can actually ask the doctor to coat it with an opaque, a composite opaque, so they can actually intraorally coat the entire prep and bond composite to it and then impression it. So that's one way around it. The other way around it is we're doing implant restorations, and I have an abutment that's going to be cementable next to a natural tooth, and we made a gold or a titanium abutment. We may opaque the abutment either with composite or ceramic, and then build our zirconia over that. So I handle it different in each case, but the goal is the same. No matter how good you are, you can't hide what's there unless you understand the optics of the material that you're putting there.
All right, great. Well, Peter, another great program, very informative. A lot of spider webbing, right? I mean, there's so many topics that lead to one to another to another to another. That's why we're having so many programs with you.
Jim, you know what's funny? I was putting this together last night and this morning, and I had no idea what I wanted to talk about. And before I knew it, I had 250 slides, and I'm like, all right, I got to get rid of half of these slides without losing the topic. And it's kind of interesting. This was actually fun because it's nice to throw different challenges at me the way you've been, and for me to kind of fill them, it makes me think differently. So I kind of enjoyed this one. It was fun. But yeah, we're going to break down a whole bunch from all the topic choices that we've kind of looked through. And the people who are listening, I still see there's like 150 people out there. Don't hesitate to email me or Jim and say, you know what, I would really like this topic. I would really like this. We'll compile all that information and try to get those answers for you the best we can, whether it's on Zoom or meeting wise this way, or hopefully in the next few months, I'll be there. I'll be in your area or your town again as we start traveling again.
Yeah, we've only got about a dozen scheduled for you, and I know there's at least another 30 weeks to go in the 150 days. So plenty of time to add more webinars.
We booked 2 flights the other day, so I got 2 or 3 flights booked already. I'm starting in May and June. I'm excited.
All right. Well, I want to thank everyone that has joined us today. I appreciate you coming online, learning more about dental technology with Mr. Peter Pizzi. Peter is a fantastic trainer. I love watching him every time, and so I appreciate it. I want everyone to know that we hope to see you in person sometime. So any last parting words, Peter?
No, just thank you guys for being here. It's still an honor that when I turn on my computer and see how many people are watching that it feels nice. Thank you. I really look forward to seeing everybody in person soon, and thanks for attending. Hope to see you in the next one.
All right. Thanks everyone for joining with us on another VITA Learning webinar. This will conclude today's webinar. Thank you for attending.
Thanks, Jim.